It was Christmas of 2011.
This time 2 years ago, I was actually sitting in a hospital
in the afternoon. I got the call from my urologist.
Almost to the minute when I found out.
Come have some bad news for you.
You never want to hear those words.
Cancer is the very diagnosis that none of us ever want to hear. It brings upon uncertainties, countless questions, and even worriment. Cancer LifeNet, a navigation and supportive care program focusing on a patient's mind, body, and spirit, is a cornerstone of the Patricia D. and M. Scott Kaufman Cancer Center. Cancer LifeNet offers patients and families a helping hand along the cancer journey, providing hope and healing close to home.
In order to make a meaningful difference in our community, we knew we needed to start with something that could directly impact individuals and their families who were struggling through a diagnosis of cancer.
We want to do more than just diagnose you and treat you. Obviously, that's very critical, but also that we're taking care of you from an emotional standpoint, from a psychological standpoint, socially, financially, spiritually. Every way in which cancer impacts someone, we want to make sure that we have the right experts, the right support team, the right person there to address those needs. So it's really a holistic approach.
You know, some people don't need it. They have a lot of resources. A lot of people do not in this society, in America today. And so what we're trying to do with Cancer LifeNet is give those people the same opportunities that you and I have.
Harford County has the fourth highest cancer diagnosis rate in the state of Maryland. 1 in 3 women and 1 in 2 men will be diagnosed with some form of cancer during their lifetime. The visionary founders of Cancer LifeNet recognize the need for supportive care services offered to cancer patients and their loved ones close to home.
In the first year of our Cancer LifeNet program, we provided over 500 patient encounters. This year, we will have provided over 5,500 patient encounters.
4 years ago, we established the Kaufman Cancer Center. In my opinion, with our affiliation with University of Maryland Medicine, it's been one of the best things that's ever happened to healthcare in Harford County.
From the moment I walked in the door, I knew I was in the right place. I was devastated from getting the diagnosis. I didn't know really where to turn, even though I had a wonderful doctor. But I needed people who had been experiencing that.
It connects them to a community of other survivors so that they know that they're not alone. And the more people you have involved, the bigger that community becomes.
Curing their disease is one aspect, but bringing them back to what I call wholeness is a totally different story, and that involves spiritual aspects, emotional aspects, financial aspects, and that's really what Cancer LifeNet is there for.
If you go into the Cancer LifeNet office on any topic that you have a question or concern about, there's someone there who is going to sit down with you, help you, and it's all free of charge. There isn't a better program around.
Cancer LifeNet is the cornerstone on which this entire cancer program, the Kaufman Cancer Center, and just the cancer delivery in Harford and Cecil County is built on, because it's essentially made up of people who live here. Many of us have had cancer or had a family member who's had cancer, so we really understand at a core level the emotional aspects, the financial aspects, including the medical aspects.
I was able to get all of the necessary treatment and all of the support I needed in less than 5 miles from where I live. If there were ever any issues with regards to my treatment, I had a whole team of doctors and nurses and counselors there to support me pretty much 24/7. The amount of care that I received during my period of treatment and even after was second to none.
My children went through the CLIMB program to learn how to deal with my diagnosis, and the CLIMB, Children's Lives,
including moments of bravery,
was a wonderful resource.
You know, there are moments, even with the best support system, that, you know, we're human beings, we're still going to have our down moments. How do I talk to somebody in my family who, first of all, they're scared? My husband, as great as he was, there were times when I could look in his eyes and he was petrified, so you're trying to be strong for everybody. So the last thing you want to do is maybe talk to him about your hair falling out. Never forget, I called Patsy, come right in. You know, she sat with me for an hour, and, you know, when I left that meeting with her that day, I had a different perspective.
8 of the last 10 years I have been chair of the foundation, and numerous times during that period of time I always said, you never want to hear those words, you've got cancer. Well, 6 months ago I heard those words. It's a tough way to go through it, but when you experience cancer and you go through and utilize the services that we have helped establish, it makes it all worthwhile.
Cancer LifeNet was founded on a shared vision of friends and neighbors helping friends and neighbors. Thanks to philanthropy, more than 10,000 community members living in Harford, Cecil, and Northern Baltimore counties have benefited from the Cancer LifeNet program since its inception in 2006. Every dollar raised, whether from an individual or a corporate partner, from an annual gift or from a community event, makes a difference right here in our community.
When I'm asked the question, why is philanthropy so important to the Cancer LifeNet program, it's really very simple. It's about giving back. It's about making a difference in the lives of our families and our friends and our community. And you know, it comes down to the fact that we're all connected in one way or another.
I think service to the community is something that gives you more than you actually put into it. Whether you give time or you give your talent, or you give money. You're serving your community, you're serving your fellow man, and it gives you a feeling of that you're not only that you're needed, but that you have actually done something to help someone else.
10 years ago when Cancer LifeNet was started, I think the budget then was somewhere around $150,000. Right now it's up somewhere approaching $1 million a year. This money comes from philanthropy. Insurance companies do not cover this, and this is a service that is offered by us to cancer patients and their families.
Having a free support program for cancer patients that is run by professionals who are trained to help cancer patients through their cancer journey is a wonderful asset to our county. They can get their support right here and get their cancer care right here in Harford County.
I believe that Cancer LifeNet is a very important asset to our community because our cancer patients and their families have a resource, a community resource, so close to home.
This is about helping the people in Harford and Cecil County. It's about local people having a local solution for a devastating disease. And I always say, you know, 1 in 2 men are going to get cancer in this country, 1 in 3 women are going to get cancer. It affects all of us. So we want to build a system that we're going to need someday, if not for ourselves personally, then for our relatives. And so support this because you're supporting yourself and your family.
It was the best decision I ever made to come to the Kaufman Cancer Center, be a part of Cancer LifeNet, and benefit from all of the different things that it offers. You know, you can't put a price tag on that.
Having the support that I can call Cancer LifeNet at any time, and they were willing to open their door to me to talk to me, was 100% a blessing. I mean, there's no other word to say that was a blessing.
Yes, cancer diagnosis is disappointing. However, okay, this is my new journey, and how am I going to embrace it? And how am I going to make the most of it? And how am I going to stand up and be that positive role model for my daughter, for my son, for my husband to know when you're kicked down, you can get back up, and we can fight, and we will fight, and we have it in our blood, and we're going to get through it.
For 10 years, Cancer LifeNet has been a source of strength and comfort, a safety net to more than 10,000 of our neighbors. Today and in the future, you can help. Share our story. Continue your support, allowing others to benefit from this program at a time when they need it most. On behalf of the Cancer LifeNet team, the Upper Chesapeake Health Foundation and its Chesapeake Cancer Alliance volunteers, and the University of Maryland Upper Chesapeake Health Kaufman Cancer Center, thank you for supporting our community healthcare mission. With your help and your shared commitment, Cancer LifeNet will continue to make the lives of those affected by cancer, our patients, their husbands and wives, their sons and daughters, better, brighter, and stronger.